Okay, ready. Good afternoon, everyone, and welcome to today's webinar. I want to give a special welcome to any nurse that might be attending. And of course, from the bottom of our heart, Happy Nurses Week. You are truly our heroes, and we owe you a debt of gratitude. I am Susan Ryan. I'm the Senior Director for the Greenhouse Project, and I'm delighted that you took some time to share in a special webinar for nurses today. And I'm really excited for Select Rehab and for their sponsorship of a two-part webinar series. Select Rehab has been kind of a faithful partner of the Greenhouse Project. We have really found some synergy in our aligned values and person-centered approaches. But let me read to you a little bit more about Select Rehab. Select Rehabilitation provides skilled interventions with a functionally based treatment approach that prepares residents for the specific activities and skill sets that they need to successfully transition and remain in their discharge environment. Select Rehab therapists are trained in evidence-based practices which equip them to perform resident-centered techniques, focus on each client's desired functional improvement. Therapists utilize purposeful and functional activities and interventions in order to promote health, prevent injury or disability, and sustain or restore the highest level of independence possible. Where restoration is not possible, therapists utilize compensatory techniques to improve one's ability to complete functional mobility, communication, and ADL, or adaptive techniques aimed at environmental modification and staff training for caregivers. Therapists work closely with each community to maintain and encourage the outcomes through continued research-based concepts for successful aging. And again, I can't say enough for their person-centered focus, their evidence-based practices from which they work, and functionally based treatment. Select Rehab is grateful for the exceptional care being provided by communities across the country during the pandemic. We'd like to give a shout out today on National Nurses Day to all our nurse heroes. We appreciate you and thank you. And that was from Select. So speaking of gratitude, we want to remind you of our hashtag campaign that is currently going on, hashtag 7 Days of Gratitude. This is giving you the opportunity to take a picture, post of your favorite nurse, and show your gratitude in all that they are doing, especially during this pandemic. So let me introduce today's speaker. I was really honored to talk to Dr. Kathleen Weissberg a few weeks ago, and as we were brainstorming this two-part series, I got pretty excited, first of all, at the topic you're going to be hearing today, but even more so about kind of who Kathleen is as a person. So here's her bio. Dr. Kathleen Weissberg, in her over 25 years of practice, has worked in adult rehabilitation, primarily in long-term care as a clinician, manager, and researcher, and most recently as education director with Select Rehabilitation, where she oversees continued competency and education for approximately 6,000 full-time therapists. She is also a professor at Gannon University in Erie, Pennsylvania, and at Chatham University in Pittsburgh, Pennsylvania. Lovely to be home. She has authored publications on topics ranging from patient wellness and trauma-informed care to dementia management and coding billing. Today's topic, I don't think, could be even more timely than this: resilience and well-being amid COVID-19. So I'm going to get out of the way, and I'm going to turn it over to Dr. Weissberg or my friend Kathleen. So Kathleen, it's all yours.
Kathleen, you seem to be muted. There we go. Thank you so much for that. So hopefully everybody can see my screen. Thank you for that introduction. And isn't it lovely, everybody working from home and the challenges of working from home these days. So I think today is a timely topic. We talk about resilience, but I call it trauma-informed care as it relates to COVID-19. And if you think about what we're going through right now, there is uncertainty, there's stress. And when we are under stress, we trigger our fight or flight response. And for some, that's going to mean difficulty with executive functions. Others, it's going to be difficulty with emotional responses. Other people have difficulty making decisions. But I think what's important is how we respond is very much individualized. And we're going to talk about today, how do we care for our residents during this time? What's our approach? How do we approach staff? And I think more importantly, how will our future interactions be impacted by this? And I think too, we're going to talk a little bit about this later on, but just consider too that social distancing, isolation, and all these extreme changes are also, not only are they hard now, but I think down the road, we're going to continue to see issues with depression. So with that, just a couple of quick housekeeping items. First of all, for CEUs, you do need to be logged in for the session the entire time. At the end of this session, you will receive a link for a session evaluation. We ask that you go in and you complete that session evaluation within 7 calendar days. And Alyssa Ruby, who is my administrative assistant, will email you directly a certificate for anyone who met the attendance criteria. Today's session is approved for nursing CEs. Select is an approved provider of nurse CEs by PSNA and also by the California Board, and you can see our numbers there. Okay, and these are the objectives super fast: to define the key elements of a trauma-informed approach, apply those to the current pandemic environment, give you some suggested guidance, some practical strategies, and then I want to also toss in there some techniques that supervisors can utilize, particularly with our own staff. So I think we're going to start with some key definitions. And the slide gives you the SAMHSA, the Substance Abuse and Mental Health Services Administration definition of trauma, and I'm not going to read it to you. You can certainly read that. I think what's important for us to note is that there is not one universal definition of trauma. And I think if we look just at trauma-informed care, trauma is, childhood neglect, having someone with a mental health disorder or substance abuse, military, systemic poverty or discrimination. That's what we would traditionally look at. But let's talk about what we're going through right now as it relates to this pandemic. And yes, there are events and episodes that are traumatic. Maybe you've lost a loved one, you're losing income, you've been, furloughed, just the work environment, all traumatic types of experiences. Now, a couple other quick definitions. Secondary trauma is one that we need to know about. This isn't my trauma, but this is someone else's. And I am so empathic that I am feeling that trauma right alongside of that person. So I'm feeling it as almost as if it were mine, but it's your trauma or someone else's trauma. Trauma-informed is really understanding trauma, its awareness, its impact, and then using that trauma-informed care, that trauma-informed approach to deliver our care to our seniors is the trauma-informed care approach. So trauma-informed is understanding, using that information is trauma-informed care. So I go through this kind of quickly, but I think what I want you to know though is that trauma-informed care is not intended to be therapeutic in nature, such that its main function is not intended to alleviate symptoms of stress, but instead to guide and inform practice or policy. So what we're going to be talking about today, some of the resources and the recommendations, these are not substitutes for the healing modalities and trauma-specific healing services, but just some things to keep in mind as we are approaching individuals during this time. So what is a trauma-informed approach? I love this slide. It's probably my favorite. Trauma-informed care seeks to change the illness paradigm from one that asks what's wrong with you to instead what happened to you. And the second quote, a non-trauma informed system punishes and blames your adult actions and asks, "What's wrong with you?" A trauma-informed provider will hold you accountable for your adult actions, but give you space and time to process what happened to you without adding guilt and more trauma. And I apologize that I read that to you. But that second quote came from a patient, came from an individual that we serve. And I think it's really powerful. It's holding me accountable, but instead of saying, "Holy cow, what's wrong with you?" It's instead, "What happened to you to give you this view of life?" When we look at a trauma-informed approach, they realize that trauma is widespread. They recognize those symptoms in individuals. They respond, and I think most importantly, they resist re-traumatization. And that's kind of what we're looking at doing here as we go along. Again, trauma comes in a lot of different forms, but when we look at trauma-informed care, it's open-mindedness, it's compassion that every, and I'd use patient here, individual, senior, adult, whatever language you want to use, because anyone can have a history of trauma that impacts how they encounter a healthcare system. So we're going to go through the 6 key principles, and I'm going to skip over this slide and jump right into them. The first principle in trauma-informed care is something called safety. It's the feeling that we as staff, that our patients, that our families, individuals, everyone feels physically, psychologically safe. All interactions need to promote a sense of safety, and that sense of safety is that person's sense of safety. It's their definition, not ours. So we could be saying, "Oh, well, we have locks on our doors, we have really great lighting, whatever. Of course it's safe." But if that person doesn't feel safe, then it's not safe. So it's always their definition. So in our current environment, how can we do that? I mean, think about it. There's really high stress right now. We might be seeing poor judgment, poor attention. Safety, physical safety right now is a huge priority, I think. So the people that we're serving, we need to ensure that we give them the feeling that they're being protected, that their physical safety is the top priority as we initiate any sort of response efforts to this crisis. Alongside of that is communicating clearly. Staff, patients, community partners, families, service unit users, whoever that is, clear, concise communication without any sort of shame or stigmatizing language. It's also about soliciting input with the goal of understanding what can we be doing to help you feel safer than maybe what you are today, or what is your definition of safety. And again, attending to staff unease, and there's quite a bit of that. So physical safety is important. I think emotional safety is even more important. It's people knowing that we are looking out for their well-being. So how do we do that? We help staff understand what to expect. We demonstrate something called flexible consistency. And what in the world does that mean? Obviously, it's going to be difficult to be consistent and predictable right now, but where and when we can be predictable, where we can be consistent, we want to do that. And if we can't be consistent, if we have to deviate, we explain, we tell people why, we give them the background behind it, because that helps them to feel much safer. It's obviously paying attention to nonverbal communication as well. Gestures, facial expressions, movements, tone of voice, etc. Very, very important. And then building in time to check in about feelings, whether that's the individuals you serve or each other. We need to feel supported. We need to feel like we can speak up and talk about our feelings, talk about work-related stress and other emotional issues that we might be seeing. Now, the second component of this is trustworthiness and transparency. So it's trust between all of us regarding operations, decisions, and that trust, that transparency is critical for developing those relationships. So we want to make sure that we acknowledge that, again, the setting is safe and that we are protecting those that we are here to serve. So what does it mean to have trust and transparency in our current environment? Well, again, it goes back to communication. You're going to hear this as a common theme. Clear, direct, frequent. That's going to keep everyone, to the best of our abilities, at ease. If you're stressed, your brain is going to fill in missing information and probably fill it in with information that may not be accurate. The other thing is explaining the why behind decisions. Again, even if it's a policy that nobody likes, if you understand the why behind it, you might be a little more apt to go along with it. That's also about being transparent with policies and practice. Make sure that, when we are making changes, that everybody can see those changes. Again, if you have to say, hey, starting tomorrow, we're going to start doing X, Y, and Z, explain the why, everybody gets to see it, everybody gets to comment on it. Conveying strength and sensitivity. Again, staff and our residents are going to be looking to us for strength, for leadership. That's what creates trust. We need to, everyone, feel like we are being cared for, because that builds trust as well. And then, of course, giving a trusted source of information. Where people don't have that trusted source, they make it up and they go to places a lot of times that are not so trustworthy. Now, the next component is peer support. So when we talk about peer here, we're talking about a person with a lived experience of trauma. When you can connect peer to peer, it creates a sense of safety, of hope, of trust, of collaboration, of mutual self-help. We learn from each other, we grow from each other, we help each other. So how do we do that? Again, I think the one big thing here is positive attachment and bonding, getting those relationships and doing what we can do to help people to support that. So whether it's text or phone or video conference or Zoom or FaceTime or whatever, doing what we can do to set up those situations where we can still do our check-ins. And then creating that culture of calm where we model consistency, we model what we want to see in people. We're not freaking out. We're not, going around, just running around willy-nilly. We're calm and we have a plan. I think the biggest takeaway that I have seen in all of this is this last bullet, and it is my absolute favorite. Physical distancing, not social distancing. We've got to stay 6 feet apart or whatever it happens to be, but we never want to lose sight of the fact that right now we need to have those social relationships. They're so critically important during these times of high stress. So again, we want to do what we can to foster that, and we'll talk more in a little bit, some practical strategies for that. The next point is collaboration and mutuality. What does this mean? It's the leveling of power differentials. So this means a flattening of the administrative hierarchy, and there's a recognition that true healing happens when we have meaningful sharing of power. And again, I love this quote. One does not have to be a therapist to be therapeutic. That comes again from a patient. You never know who somebody's going to reach out to. It could be housekeeping, it could be maintenance, it could be the person driving the van. Everyone is equal in a trauma-informed type of environment. So what does that look like? Again, when we talk about collaboration, you might not be making policies, but we have to think about making policy decisions with other systems in mind, collaborating upstream, downstream. How is it that what we are doing right now in our organizations will impact those organizations? Working together to create those policies. Again, pulling in the people that you serve, pulling in staff, incorporating new partnerships, and again, collaborating across teams, across departments, if you're multi-site, across sites, getting everyone's input. Again, a lot of these decisions that we're making right now are not very likable, but the more input you have to them, the better off you'll be to follow them. The fifth principle, empowerment, voice, and choice. The organization is fostering a belief in the value of the people served, their resilience, their ability to recover. So when we look at this, individualized strengths are recognized. We're really, pushing that individualized side of it. And what it does is that we are supporting our clients. We are giving them those self-advocacy skills. And again, we become facilitators in this We are not controllers. We allow that individual to guide us through the process. So what does that look like in our current crisis? Let's think about it. There's a lot of control that has been lost, a lot of power that has been lost. So where we can boost that up and build that up again, it's going to pay dividends. So what decisions maybe can staff make without seeking higher approval or higher input? Providing choices, even if they're small choices, give those, because that will give us a voice. Providing staff with scripts, maybe to explain the situation. And then listening to staff ideas. I think, again, this is the best thing. You know, have you noticed something that maybe we could do differently? Do you have an idea where we could maybe use a better trauma-informed approach? So getting their ideas and getting their inputs. And then the sixth principle, finally, is culture, historical, and gender. So cultural stereotypes, cultural biases have no place here. The organization is gender responsive. We recognize that healing power that comes from culture, that comes from connectedness, and we incorporate that. So what does that look like? You know, remember that crisis is going to affect groups differently, depending on a lot of different factors. And it could be history, it could be access to service, it could be systemic oppression. We need to think about the communities that are going to be impacted by this crisis. And we want to build upon the strengths of those communities, of those cultures. We want to make sure that anything we write into policy doesn't have unintended consequences. We don't want to cause harm, obviously. Be mindful of, obviously, historical context. Use strategies that give, again, promoting trust. And then I think importantly, as we're providing information to individuals, keep in mind culture. So it's multiple languages, written and spoken format, keeping preferences for communication in mind, certainly looking at health literacy and literacy in general. So keeping all of that in mind. Now, this goes without saying. Trauma doesn't occur in a vacuum, obviously. It occurs within the context of community. And again, that could be geographically, your neighborhood, your town, virtually, maybe as in a shared identity or an ethnicity, or organizationally, where you work, where you worship, etc. And how we respond really sets the tone. When our communities really understand trauma and understand what people are going through and help them to heal, that's just what you do. You facilitate that recovery. If we overlook it, we avoid it, we don't want to talk about it, ultimately what may happen is we re-traumatize individuals, and that can interfere with healing. Now, obviously, a community can be subjected to a community-threatening event. And when we talk about this in typical trauma-informed care, we talk about, oh, there was a shooting, or there was a tornado that came through, or something like that. Obviously, each community, whether it's an isolated community, you know, a healthcare center, or your town, we're going through this in our own unique ways. And we're going to feel the effects of this for a long time to come. It's not going to be just we flip the switch and we get back to normal. We're going to feel this for months, maybe years, generations to come. So when we look at this, again, I think what's important is we don't have any sort of stigma. We don't have any sort of bias or any sort of shame. We're very open to hearing what people have to say, their concerns, what's bothering them, what worries them. And when we talk about that, we focus on how that impacts their health, or maybe how I can facilitate them toward recovery, not just focusing on the traumatic experience itself. So that's kind of an introduction to the principles. Before I get into some of the very real, tangible things that we can do, I want to talk a little bit about management and supervision, because, you know, we're talking about the people that we serve, but let's think about it. Trauma, what we're going through right now, is leading to all of these things. Issues with compliance, low motivation, maybe turnover, poor judgment, depression, you know, all of these are a huge impact. And some of the things that we might be seeing, I'm not going to read these slides, that you can certainly read them, but things like anxiety, dread, fear, sleep disturbances, headaches, GI or gastrointestinal types of issues, addictive or compulsive behaviors. And I'm sure a lot of people are seeing this right now, overeating or substance abuse, or if you're working from home, maybe compulsive working. Even impaired functioning, decreased ability to take care of your own self-care. And we're seeing this not only in our clients, but in each other, our coworkers. Maybe suspicion, bitterness, cynicism, helplessness. Again, a lot of feelings that probably many of us have. Maybe we're canceling appointments. There's decreased intimacy or trust in relationships. Maybe that person just feels emotionally paralyzed, and you start to see that. And you also start to see changes in frame of references. So a change in their fundamental beliefs, loss of faith where they've had faith before, despair, loneliness, distortion of their values. And again, this is what we are going to see in typical trauma-informed care, but I think really now related to COVID, related to this global pandemic, and we're going to see it in each other. So what do you do? How do you address this? And I did not include this as a handout, but there is a measure out there called the ProQual, the Professional Quality of Life. It's available in the public domain. It is a fabulous tool. If you've never used it, it's one that I use quite a bit. It actually scores you. You do it on your own, and it talks to you about what your compassion satisfaction is, what your level of burnout is, and any secondary traumatic stress. It's a wonderful, and I'm actually going to go to the next slide. In the third bullet down, it's a way for you to develop your own comprehensive self-care plan. We develop care plans for the individuals that we serve, right? This is our care plan. And again, if you work in a trauma-informed type of environment, you should be able to share these without any fear of reprisal, without any fear of negative impact on you, but to talk to your supervisor about it so that it doesn't get to a point where you're resigning, you end up in the hospital, or something else happens. We need a very safe, non-judgmental environment. And again, that's a tool, it's a self-assessment tool for you to kind of figure out what do you need to address yourself so that you can be, a better caregiver, if you will. Now, along those lines is something called trauma-informed leadership. And when we see emotional responses in the workplace, like we're seeing right now, when they're triggered, everyone is going to respond differently. Some people are going to be very stoic and detached, and that works for them. It's a defense mechanism for them. Others are going to be emotionally flooded and just, maybe they're crying quite a bit, or they're sharing a lot. Again, everybody's very different. But when we look at trauma-informed leadership, it's recognizing that people have emotional scars, and it's having empathy and compassion for employees, which, oh, by the way, is so different from anything we've ever learned in management philosophy or in management theory. We've always been told, step away, be that objective person, be the leader, be the manager. And here we're saying something totally different. Have empathy, have compassion. And I know I'm telling that to a group of people that has that, but don't feel like you shouldn't. Don't feel ashamed to do that, because it's what's going to help your staff, your coworkers, your peers, your family members really to get through this time period. Why do it? You can read the slide. It helps us. It increases well-being. It's best practice. And I think in a workplace, most importantly, it promotes retention and reduces turnover. I think the last thing any of us need right now is turnover. We want to keep the staff that we have rather than hiring in new. So again, what is it? It's relationship-based supervision. It's genuine sharing. And again, I think, if you're a supervisor, if you're not, even if you're just a coworker, your quote unquote clients are your peers, or maybe the people that you supervise. And when they see you interacting with others in this trauma-informed way, you're modeling what you want them to do. And I think that goes a long way. We want to model those behaviors. And again, some of the things that we can be doing, again, real things, scheduled meetings, discussions about change. We've talked about that a little bit, and sharing experiences. We'll talk about this on another slide, but people need to have that open door to be able to share, and be able to share without fear of losing their job, being the next one furloughed, being written up, whatever it happens to be. They've got to work through all of these issues, and we need to be there to support them. And I think this sums it up. When employees experience, and it doesn't have to be employees, you could put any word in there, residents, patients, peers, family, whoever, when they experience empathy, understanding, compassion from the leadership team, they're safe, they're respected, they're recognized. And when I read that, I mean true empathy. So every, boss somewhere along the line has been told, oh, you really have to connect with your employees, make sure you recognize their birthdays and this and that. And when people are forced to do it, we see through it. We see that it's not true, it's not genuine. This really needs to be genuine. And again, whether it's the people that you serve, whether it's the people that you work with, they're going to feel safe and they're going to feel recognized. So one last slide on this before we get into some of the other things, and I think a lot of this is really important. We have high stress right now, and recognize that our own stress, we bring it to work, and it's going to transfer over to our patients, our residents. So some things that we can do: share messages about space. So, you get stressed or you're upset about something, you give yourself some space to deal with that. So share that message and say that it's okay to do that. Certainly share about routine, and we'll talk about that, but the more routine that we have, the more we can stay grounded in what we're doing. And I think along with that, it's a new normal right now, helping our residents, they should have a voice in obviously what that routine is going to be. Some really important things: share some resources about education and abuse. We're already hearing and understanding that in other countries, the rates of domestic violence and child abuse as well have increased dramatically during this global pandemic. Also, suicide. So be watchful, be vigilant, because we are going to see that, and share information about that. Practice self-kindness. Remember, you can't take care of anybody else unless you take care of yourself, right? And then gain insight into where you might be struggling. I think that's important. That's where that ProQual type of resource comes into play. Figure out where you're having issues so that you can address them yourself. Okay, so now the fun stuff, and we've saved a good 30 minutes to talk about this. What can we do? What are some real things that we can do? I think first we need to talk about depression. Social distancing, which again, I don't like that term. I like physical distancing. And these extreme changes that we're seeing in daily life are really hard, and we need to be prepared for an epidemic of clinical depression. We're going to see it in individuals, in families, in communities. We need to be prepared. We have a perfect storm for it, if you will. The unique environment suggests that we are going to have a large proportion of people with depression, and unfortunately, it is likely to be distributed inequitably. So we're going to see some people, and we'll talk about this on another slide, who are at greater risk than others. So what can we do? What can people do? First of all, reach out and stay connected. And on your own, it can be really difficult to maintain that healthy perspective. When you're depressed, you have that tendency really to withdraw, to isolate, and connecting is hard. So we have to make the effort to stay connected. Reaching out, and I think that's the other piece, reaching out is not a sign of weakness. It doesn't mean that you're a burden. We have to really try to keep up with that social side of things, even if you don't feel like it. We also need to do things that make you feel good, things that relax you, things that energize you. And we'll talk more about this, but it's following a healthy lifestyle, managing your stress, setting limits on what you can actually do, getting proper sleep, all of those things. Keep your stress in check, and we're going to talk about those on some upcoming slides. We're going to talk about get moving as well. Exercise is it's a really powerful depression fighter, and we'll talk about that on another slide. Eating a healthy diet, so avoiding caffeine and alcohol and trans fats and foods that are high in chemical preservatives. And again, there's another slide on that. We'll talk about that too. Getting sunlight, just getting even 15 minutes a day will boost serotonin levels and actually help to elevate your mood. And I think a really important one, challenge the negative thinking. Depression puts a negative spin on everything. And, you know, you can't just break out of it by saying, okay, think positive. Rather, what you need to do is really figure out, identify the types of negative thoughts that are fueling your depression, and then replace those with a more balanced way of thinking. So what does that mean? These are the negatives. All or nothing thinking, looking at things in completely black and white with no middle ground. If everything were perfect, I'm a total failure, something like that, all or nothing. Overgeneralization, generalizing from a single negative experience, expecting that to hold true forever. The mental filter, so ignoring the positives and focusing only on the negative, pulling out that one negative thing that went wrong rather than every single thing that went right. And I think a lot of us do that. Diminishing the positive, coming up with all the reasons why all those positive things that happen just flat out don't count. Jumping to conclusions, making negative interpretations without evidence. So you're either a mind reader or you're a fortune teller sometimes. Emotional reasoning, believing that the way you feel reflects reality when oftentimes that's not the case. The shoulds and the should nots, holding yourself to a strict list of what you should do, what you shouldn't do, and then you beat yourself up if you don't live up to what that list is. And then finally, labeling, classifying yourself based on your mistakes and your perceived shortcomings. And I think as we go through that list, probably a lot of us feel those ways many, many times. So what do? This is where you put those thoughts on the witness stand. Once you identify it, start to challenge it. Well, what's the evidence that this is true? What if it's not true? What if a friend of mine had this thought? Well, what would I tell him or her? Is there a better way of looking at this, an alternate explanation? How might I look at this if I didn't have depression? As you start to cross-examine some of those negative thoughts, you're surprised at how quickly they start to crumble. And in the process, you get a more balanced perspective, and it helps relieve depression. So again, this is for the people that we serve. This is for each other. Many of us have these thoughts. Now, I told you already that we would talk Oops, sorry. Give me 1 second. Obviously, there's a recording in there, so sorry about that. So talking about dealing with stress, what do? You know, we're in a strong service orientation type of environment. We don't have time. We don't always recognize our own needs. There's stigma, there's fear, there's what have you. And I think too, people right now are really concerned about speaking up about their stress, about whatever they're experiencing, because if they do, they either may not get the support, they might be furloughed, they might be fired, they might be, who knows. So we don't always deal with our own stress, but we have to. We have to make this a priority. We put everyone else's needs above our own, and we have to make our stress a priority. So what do? You can obviously read the slide, but self-monitoring, pacing, check-ins, we already talked about that, timeouts, brief relaxation periods. I think the two that really speak to me here are focusing our efforts on what's actually within our power and accepting what you cannot change. I'm a firm believer of an old management philosophy called the fish philosophy, and probably some of you have heard of it. And there's a principle in there that says, choose your attitude. I may not be able to choose what happens to me in my workplace, what happens to me in my daily life, but I can choose my attitude. I can choose how I'm going to approach it. And I think we all need to feel that way. There's so much outside of our control right now. You can't beat yourself up about it. And I think too, where we can foster fortitude, patience, tolerance, hope, that's all going to help us with stress. What we want to avoid are these things. Working too long without checking in on a colleague. I mean, it might be nice to work alone, but that isolation doesn't always help. We periodically have to check in. We shouldn't be working around the clock with few breaks. That's going to break us down. Excessive intake of sweets and caffeine. It's great for the short term, but we crash in the long term. Feeling that you're not doing enough. Engaging in that self-talk and those attitudinal obstacles. Things like, oh, well, it would be selfish of me to rest. Everybody else is working around the clock. I need to too. The needs of my patients are way more important than my own. Or my favorite, only I can do X, Y, Z. This is where we go back to that trauma-informed approach. We flatten the curve. Now is the time you have to give up control. We have to share the burden and share the load. We are not one, but we are many, and that's how we're going to get through this. Some very practical things that you can do. Relax your body. Do things that work for you. I can't tell you what's going to work for you. You got to figure that out. Maybe it's deep breathing, maybe it's stretching, maybe it's meditation, it's prayer. It's an activity you like. Even if it's 5 minutes, it's going to help with your stress management. Between stressful activities, pace yourself, take a break. Talk about things to your loved ones, again, if that's something that you feel comfortable doing. And if you don't, maybe you keep a journal, you write things down, and again, do what you can to maintain that sense of hope and positive thinking. Some very real things that we can do at work. Progressive muscle relaxation, one of my favorites. It's you're focusing slowly on tensing your muscles and then relaxing your muscles, one group at a time, starting with your feet all the way up to your neck. Because what happens is over time, if we have consistent stress, we tense those muscles and we become so accustomed to it that we just start to get really tight, sore muscles, and we're just not really even aware of it. So with practice, you can start to reduce that stress using that muscle relaxation. One of my favorite ones is visualization. Go to your happy place. Maybe this is a vacation spot. Maybe this is a family type of place. Maybe it's any place you'd rather be other than work, let's face it. And it's not just visualizing, but think about what would you smell there? What might you taste there? What might you hear there? Really immerse yourself in it. And that quick mental vacation that you give yourself can really help relax your mind and body. Deep breathing, there's 100 different ways to do this. But the important thing for deep breathing is that it increases the supply of oxygen. It gives you a sense of calmness. So you can, breathe in, hold it, and then breathe out for a count. You can, there's called something called like 4 corners breathing or something, I think it's called, that you face each of the corners of a room and take a certain number of deep breaths. You can visualize while you're doing it. Again, whatever seems to work for you. Some slow, deep belly breaths can give you some immediate stress relief. Now, along with kind of side by side with visualization is engaging your senses. And again, you figure out what works for you. Maybe it's visual that you look at photos. Maybe it's smell, the smell of baking bread or lavender or something. Maybe it's taste. It's your favorite candy. I don't know what it is, but something that you really tap into your senses. And then laughter. It's probably hard to find laughter right now, but there's a lot of, funny memes out there or funny cartoons. But the reality is laughter is the best medicine. So surround yourself with something. Maybe it's even just laughing at yourself, sharing a joke. You got to figure out what works for you, because what works for you isn't going to work for somebody else, in the same way with our residents. Practice definitely makes perfect. You'll figure out what it is, and then you'll continue to do that and be able to, again, maximize your stress relief. A few other things. Start your day off right. Good nutrition, proper planning, a good attitude. There's a reason they say that breakfast is the most important meal of the day, because it really is. Being clear on requirements. Now, what in the world does that mean? I think it's important right now to know, what are the requirements? Am I meeting them? Am I not meeting them? We beat ourselves up, let's be honest, and we always feel, I think sometimes, like that we're not meeting up to requirements. We're not doing everything that we should. Let's be open about what those are. Be very transparent. Staying away from conflict. I don't think we need any of this right now, and that's important. So, whether it's sharing politics or some form of humor, or even just the way we interact with each other, let's be gentle with each other. Let's be patient. Let's be kind. Staying organized, let's be honest, again, you're going to be thrown a ton of curveballs all the way through this. So the more we can have routine and stay organized on the simple things, when the curveball comes, maybe it won't feel so bad. Being comfortable in our environment, so clothing, shoes, lighting, those sorts of things. Don't multitask. At the most, you might want to dual task, doing two things at once, but multitasking is not so good. Keeping your perfectionism in check. Those of you who know me know that I'm a perfectionist, and I'm sure it drives everyone completely insane around me, but it drives me insane too. So let's keep that in check, particularly now, because we're not going to necessarily live up to that litmus test. And then again, some other things that you can do. Taking a walk at lunch, listening to music on the drive home. You're going to figure out what works for you. Now, when we look at stress, eating well is important. And right now, during this pandemic, grocery stores maybe are limiting the purchase of specific items, or only certain people are allowed in. There are only so many people at a time, or you're not going out as often. So what can you do? Purchase shelf-stable and frozen foods, things like beans or lentils or what have you, and incorporate those. If you can, I'm understanding that across the country, farmers markets and different things are opening up again. So if you can get some really great fresh things, that's going to be wonderful as well. Take inventory of what you have in your kitchen and start getting creative. I shared before we started that my husband is a chef, and so I'm very lucky, trust me. But we look at what we have on hand, we plug it into a website, and we make different things. We're getting creative and having fun with that. Pay attention to portion sizes. We're cooped up. It's really easy to overindulge. So try to maintain your regular eating habits, and as much as, takeout and drive-through is wonderful and supporting your community, some of those foods may not be our healthiest, so certainly look at that as well. And stay hydrated. Oftentimes you feel quote unquote hungry, but you're not really hungry. What you are is thirsty. So make sure that we have our water intake. And I think too, reducing, if we can, some of the processed foods. That's where we tend to go, but we all know that the processed foods oftentimes will just zap your energy and are not always the most nutritious. So where we can eat well, we want to do that. Moving well. This is your opportunity to get creative. Exercise is critical, as the slide says, for both mental and physical health. Now, the gyms might be closed, but that doesn't mean that you can't do something fun. Maybe it's a walk or a run. Maybe it's a new activity that you try. Some of us have kids at home and they have to get their PE, so do their PE with them, or set up an obstacle course, do something kind of crazy or goofy. I can just tell you, my family, we get out every day and we go for a hike or a bike ride or something. There's a lot of really cool stuff online too. We've been able to do some virtual hikes of the Appalachian Trail or whatever. So what I'm saying here is the sky's the limit. Get creative, but you got to keep moving, because that if you just stay stagnant, if you just stay on the couch, it's not going to bode well for your stress and or your depression. Sleep. Sleep is a big one. If you look at the preliminary research related to sleep, we're already seeing during this pandemic that hospital workers in general, or healthcare workers in general, are not getting the recommended 7 to 9 hours of sleep. They're working round the clock. And that disruption is having significant health and safety consequences. We're seeing increased accidents, we're seeing increased errors, and we're seeing infection, because if you don't have the sleep, you're not able to fight off the infection. You don't have the immune response that you need. So got to make sleep a priority. Easier said than done, I get that. But some of the things that you can do. When you wake up, get bright light, 15 to 60 minutes. Natural light is going to be your best, outdoor light, but depending on where you are or what have you, that may not happen, even if it's a light box. That is signaling your body that it's time to start the day. If you are going to exercise, you're going to move, do that earlier, closer to your wake up time, because again, that helps you to just wake up, start your day, and it can improve your sleep quality. Take naps, even short naps, less than 20 minutes are certainly very, very helpful. And you can also bank your sleep. I know they say you can't, but there's some decent research out there now that says that you can. Longer naps or even extending your sleep can help you to make up for lost sleep or anticipate when you're not going to have some good sleep. You know you're going to be working a long shift. We already talked a little bit about caffeine, but use it judiciously. It's going to help you in the short term, but if you take it or you drink it 6 hours-ish before bedtime, it could keep you up at night. And I think more importantly, if you overutilize caffeine when you really need it to stay awake, it's not going to be there for you. It's not going to be as useful. Limit alcohol, particularly before bed. It could sedate you at first, but it does interrupt your sleep quality quite a bit. Create a regular sleep and wake time schedule. I think this is really important as much as possible, particularly for people right now working from home or what have you. You've got to try to keep that routine, because where you keep that routine, and particularly related to sleep, it minimizes what they call physiological jet lag. So again, routine is very important. Speaking of routine, create a bedtime routine. So it's quiet activities, maybe it's relaxation exercises, it's a warm shower, it's brushing and flossing your teeth, it's reading a book, it's whatever. Have that routine. It shuts down your body. It tells your body it's time to sleep. Limit activities close to bedtime, and then optimizing your environment. Keep it dark, keep it cool, keep it quiet. Get rid of the screens. So the television, the computer, the phone, etc. Shut them all down, because they do, you may not think they do, but they do interrupt our sleep. So other things that we can do, we've already talked a lot about this, but that routine, maintain it and communicate it. Predictability is the best that we can do, because that gives somebody that sense of psychological safety, a sense that they can manage their stress or connect with someone who can help them. Now, it's important too not to assume that the people that we serve understand why our routine is changing. Even if routines shift, taking time really to explain the why behind that will help to reduce their stress. Don't assume that our residents really know they know what's going on. They may not understand everything that's going on related to the pandemic, and this is where we need to tap in and ask them open-ended questions. How do you feel about not being able to see your family? How are you feeling about not being able to go out to church or what have you? That can give you a lot of insight into what they're feeling without guiding completely the conversation. Approach them with curiosity and then aim to clarify any sort of misinformation with them. Relationships can take priority. If you're working in a place where you have a specific meal time, a specific shower day, a specific activity schedule, whatever it is, you know what, that's okay, but we don't have to maintain those right now. Having those relationships, that has to be a huge focus. Connectedness is so critically important. They need to know that they have that connectedness. That'll reduce their stress. And I think it leads them to believe or know that we as caregivers care about their well-being as much as everything else. And then creating relational rituals. I really love this. Starting your day with, tell me something that happened yesterday that was really meaningful to you. Maybe you don't say it that way, but something you did that was fun. Or tell me something, that you learned yesterday, whatever it happens to be. That again helps them to be connected. So when people are facing stress and these difficult circumstances, it affects, I think, 3 areas critically. Those are the sense of safety, feelings of connectedness, and feelings of hope. So let's talk about each of those. We've talked about safety a little bit. I think what's important here is, for a lot of people, we're going through a lot of things. It could be loss of income. It could be loss of a job. It could be loss of a loved one, somebody is sick or what have you. There's insecurity. Maybe you can't pay your bills. It's all this baggage that's going on, if you will, all of which can severely damage a sense of safety. And again, you may not think that it's directly impacting the people you serve, but I guarantee it is. If they have family members, somewhere else who are impacted by this, you can bet that they're going to be feeling it. So what can you do? Offer them ways to connect, and we'll talk about that in just a second. Maybe it's virtual get-togethers with their family members. It's, again, keeping that routine and planning things that are fun. Connectedness. I said it before, I'm going to say it again. It's physical distancing, not social distancing. So, web conferencing, Zoom, what have you. Writing letters. Have people write letters and mail them out to their family members, or write them to each other within your own community and deliver them. And talk very directly about how important it is to connect. And this is your social wellness checklist. Again, very similar to Getting Moving. The sky is the limit. There's online groups, there's classes, there's virtual tours of everything. My daughter and I just did a virtual tour of the San Diego Zoo earlier this week. The sky is the limit. Get creative. Look for ways to be involved and to build those healthy relationships. Again, we're going to disagree, but we don't want conflicts to turn into personal attacks. We don't want to be critical. We don't want to be angry. We want to make sure that we are compromising with each other. And then finally, hope. Hope is that expectation that everything's going to work out and the feeling that things are going to be all right. And right now, a lot of people just don't have hope. So how do you encourage that? And again, you can read the slide. Connect with somebody in your family. How did you get through troubled times? Maybe it's an inspirational speaker. We look back to history. How did those communities rebound? How can we get through this? And have each other share something from their own culture and their own stories. I mean, we're hearing so much negativity on the news. Let's focus on the positivity. Let's find some of those positive stories and share those. What else? Just a couple more slides here. Now is our time really to provide our individuals with opportunities to confirm their competence, their self-worth, their safety. So promote self-awareness. Ask them on a scale of 1 to 10, how bored are you feeling today? Or how lonely are you feeling? Remind them to do mindfulness or self-soothing exercises like we just talked about. We talked about modeling, and maybe, somebody's not verbal. Maybe we do art or pictures or drawings or even photos. Give somebody an opportunity to take pictures. Maybe we do a gratitude circle. I love this. 3 things I'm grateful for, or, one person that I'm appreciative for. And again, share those within your community. Share amongst yourselves what you're grateful for and or what you're appreciative of. The people who are at greatest risk right now, who do we have to watch out for? People with anxiety, depression, whose families are really, really impacted, or loved ones who have been impacted. People who, there's a healthcare worker or another occupation where they're exposed to the virus. Everything that we've been talking about, we can do, and providing these people some of that extra one-on-one support. Again, I think we have to really watch for those signs and symptoms of depression, signs and symptoms of possible suicide, because we are definitely seeing that. And just some final considerations, support regulations. When we're stressed, we don't manage our emotions so well. We don't regulate. So again, model the calm behavior that you want everyone else to have. Prioritizing relationships, we talked about that, explaining the why, helping staff to know what to expect. And again, I think what's important, reframing those behaviors. You may not come to work as your best self every day. Your residents may not be their best selves. It's a period right now of fear, of chaos, of uncertainty. So we need to give people the grace and the realization that their behaviors could be a reflection of the stress that they're under, not who they are. So we need to exercise patience, understanding, and give everyone the benefit of the doubt. And I say to my family all the time, I pray every day for patience, and I don't always get it. I just get more and more opportunities to exercise it. So exercise patience with each other and certainly with our residents, because I think this sums it up. We as caregivers are the best, again, I use the term resident, are the best predictors of how our residents are doing. They're watching us, they're listening to us. When we take care of ourselves, we're showing them a number of things that we know how to take care of ourselves, and we're making ourselves a priority, that they have confidence in us that we can take care of them. And we're showing them, we're modeling for them the skills that they can take care of themselves as well. And I would go so far as to say is this is not just our residents or the individuals that we serve that are watching us. It's their families, it's our peers, it's our own families, it's our children, our spouse, it's everyone around us. They're really watching us, and again, modeling that behavior for resilience. So I promised you a ton of information. Let me just go back through housekeeping one more time before I pass it back over to our hosts from the greenhouse. Remember, you needed to be logged in. You will need to complete a session evaluation if you want continuing education credits. The session is approved for continuing education credit for nurses. We're going to give you the link on the next slide, actually. You need to complete that session evaluation within 7 calendar days. And my strongest advice to you, once you get the link, just go do it as fast as you can. Get it done so that you can get those CEs so you don't forget about it. And the certificate will be emailed within about 1 week of today's session. This is the link, and I will leave this up here if you want to write it down. It's a SurveyMonkey link, so surveymonkey.com/r/capital T, capital I, capital C, trauma-informed care, _and_, coronavirus with a capital C. We tried to make it a little bit easy. Again, this will be emailed to you as well so that you can go out there and do the session evaluation for CEs. So I'll leave that up there instead of going to the thank you slide, and I will turn it back over to our hosts.
Wow, thank you so much, Kathleen. That was, oh my gosh, there were so many good nuggets that you provided for us. I took lots of notes myself, but the good news for all of you who attended today's session, you will be able to receive a PDF of Kathleen's presentation, a link to the recording of today's presentation, and obviously you see her SurveyMonkey link here that you'll need to click to do the evaluation for contact hours. The good news is that Kathleen will be back, and that we have Kathleen coming back for another wonderful part 2, resilience and well-being amid COVID-19, stress management and connectedness as the new normal sets in. So if you like what you heard today, you'll want to come back, and that's June 23. And we're so grateful once again for Select Rehab and for sharing their incredible gift in Dr. Weissberg and her incredible, insightful, and how timely a topic for today. For those of you who have enjoyed our Elevate webinar series, we have one coming up this Thursday at 2 p.m. Eastern, Elevate, Rise Above the Chaos. But we're really inviting some folks in from our greenhouse projects, John Knox Village. Mark Rayner is the administrator there. Rachel Graham is the dietitian. And they're going to share a little bit about the infection control strategies that help to mitigate risk within a COVID era. And how do we focus on that, as well as consider how we really maintain that engagement and that connectedness that Kathleen talked about. So please join us this Thursday at 2 p.m. Eastern. You can find information out on our website. Thank you, everyone, for your time, for your attention. You can go to our website to find out more information about other webinars and other opportunities to connect. And I think I'm going to close with something that I really like what Kathleen said. Healing begins in relationships, and let's not be socially distant, but let's maintain the physical distance, but socially connected. So with that, thank you again, Kathleen. Thank you, Select Rehab, and thank you for all of those that attended our webinar today. Take care.
Thank you all.
Have a great week. All right. Bye-bye.
Bye-bye.